Hello, dear aquarist. Welcome again to one of my cases of fish diseases with a nice background, the Amazon, the Rio Negro. I enjoyed beautiful trips there because today I will talk about a Cardinal Tetra. A Cardinal Tetra which was brought to me, so I did an examination and you can watch the video of the fish swimming in the aquarium and of my observations with the microscope. So watch the next videos and presentation I share with you, which I made with a PowerPoint. It's the case 197, a Cardinal Tetra that looks good at the first sight, but we found internal problems with tubercles and with a risk for health in the coming months or weeks. More details about fish diseases and treatments and diagnoses you can find in my books in different languages. And here we see the Paracheirodon axelrodi or the Cardinal Tetra. They are tank raised and given to me to check if they were doing fine. Well, some might look a little bit dark, but anyway, they just arrived. So they had some stress from the trip and after the acclimation procedure. So in general, they looked good. There were no mortalities. So in general, we thought, well, they look good. But I had to check because we select suppliers for a certain reason to get good quality in the market. The liver of that Cardinal Tetra, well, that didn't look good at all. Look at the black patches inside. So some healthy tissue was gone. Look at the spleen. We found one big, large tubercle in the spleen. And look here, some parts may be developing also some tubercles later on. We saw discoloration. This is not a healthy spleen. Here we found in the mesenteria very dark and the start of developing tubercles. And maybe also here in the intestine. And in the kidney, well, the kidney in particular was very poor, started to develop a lot of tubercles. Look at those black markings here. So a lot of unhealthy tissue. So we could conclude that the fish looked good, but after the examination, we were not sure if that would be a good fish in the near future because we found serious issues in the organs, and especially the kidneys were badly affected. We suspect most likely a bacterial infection, Mycobacterium, of fish tuberculosis because it's quite often determined and presented in scientific studies. Maybe not all the fish looked so bad for now, but they must be treated before it's too late. And we recommend a antibacterial treatment as oxytetracycline or others, and you can ask your fish doctor or your pet shop or see my books where I can recommend some products or medications to use. At the same time, you can use a functional food like Dr. Bassleer, buy fish food, Fuco. It's not professional, it's Fuco, for the control and the help of your fish. So, learn more about fish diseases in my books. I may be wrong, but it's highly unlikely, or discuss my findings in in the comments here below in my YouTube channel. Or you can get more training to become a better fish expert or get fish doctoring. Well, I hope this helped you to understand fish diseases and that some fish can look good, develop maybe in the coming weeks or months problems, so we can already observe in advance. That's some part of the job I'm doing as a fish doctor. So keep on tuned and watch more videos of fish diseases in my YouTube channel. Subscribe. Thank you for watching.